Good evening YouTube, it's Matthew here. I hope everyone is doing well. Tonight I am going to do a video in my Bladder Exstrophy lineup. I'm going to explain to people who don't understand the condition or want a bit more information because their child's been born with bladder exstrophy and they haven't heard much about it yet, or they have had scans done and the word has popped up and they don't know what it is. So we'll sit down and spend a few minutes about explaining everything, what it is, and I'll go through a few different bits and pieces here so that we can try and get this information through. Okay, now, like I said, my name's Matt. I'm 38 years of age, and I was born with bladder exstrophy. What is bladder exstrophy and epispasdias? Well, bladder exstrophy is a congenital anomaly that occurs when the skin over the lower abdomen wall, bottom part of the tummy, does not form properly. The bladder is open and exposed on the outside of the abdomen. In epispasdias, the urethra does not form properly. Okay? By the way, my source is coming from Great Ormond Street Hospital in the UK. Just somewhere different to get my information from. Okay. Back to the main part here. Okay, exstrophy means turned inside out. Bladder exstrophy is a congenital, present at birth anomaly of the bladder. It happens when the skin over the lower abdomen wall, bottom part of the tummy, does not form properly, so the bladder is open and exposed on the outside of the abdomen. In epispasdias, the urethra does not form properly, and all boys with bladder exstrophy also have epispasdias, but it can occur on its own. In boys, the urethra may be short, split as a result, and it emerges on top of the surface of the penis rather than its usual position at the end of the penis. Okay, that's the urethra. Alright? The split may be small or within. When it occurs in boys with bladder exstrophy, it may involve the full length of the penis, making the penis short and buried. Okay? In girls, the opening of the urethra is higher and wider than usual. The labia, the lip-like folds, excluding the vaginal opening, are further apart than normal, and the clitoris, a small, very sensitive part of the female genitalia, is split in two. That's not good. Yeah. Okay, what features are assigned with bladder exstrophy? As well as bladder being exposed, babies with bladder exstrophy may also have related problems affecting their urinary system, their pelvic bones. Their related problems are vary in severity and do not affect every baby. This will be confirmed using ultrasound scans and x-rays, and may be corrected during a series of operations. They include problems with the neck of the bladder and sphincter, the ring of muscles that squeeze and relax to let urine flow from the bladder. See, I have that problem. The bladder has a small capacity than usual, so cannot hold much urine. Yeah, that's me as well. The ureters join the bladder in a different place than normal. The middle part of the bony pelvis are separated. Yep. And bladder exstrophy can be assigned with other problems, but the doctor will examine the child closely to see if that's the case. Some may need to be corrected with an operation, but others do not. That more common problem includes the anus is further forward than usual. Yep, that's me. Belly buttons are lower below than usual. Yep. The umbilicus and inguinal hernia were part of the abdominal lining, and sometimes a section of intestines bulges out through the weak area in the abdominal wall and muscles. Yep. Undescended testes where the testicles are not in the usual place in the scrotum. Okay. I didn't have that problem, so that was alright. Now, how are bladder exstrophy and epispasdias diagnosed? Bladder exstrophy is sometimes diagnosed before birth using ultrasound scans. Some people of today are lucky that they are picked up on ultrasound, but a lot of them aren't. I wasn't picked up on ultrasound myself, so that is a bit of a, advantage. However, it is often not picked up before birth. There you go. But will be observed once your baby is born. Yep. Epispasdias in boys is usually identified at birth. Yep. But in girls, the diagnosis is usually made later when they are developed bladder control problems or infections. That's interesting to know. Okay. What causes bladder exstrophy and epispasdias? We don't know why bladder exstrophy occurs, so they still don't know why. It affects the developing baby during very early stages of development, at the 4th to 6th weeks into the pregnancy. This is when the organs, muscles, and other tissues start to form. It is not the result of anything either parent did or did not do, and it's simply an inherited condition. So parents out there, it's not your fault. Whatever you think you've done, it's not your fault. Okay? It's just genetics. So you don't have to. Okay, it's fine. How common is bladder exstrophy? Bladder exstrophy occurs 1 in every 40,000 births, affecting 2 to 3 times more boys than girls. If you have a baby with bladder exstrophy, the chances of having another baby born with increases about 1 in 100. People born with bladder exstrophy who goes on to have children have a 1 in 70 chance of giving birth to a baby with bladder exstrophy. If you have any concerns, doctors can be able to help you out and sort things out with birth of bladder exstrophy in babies born with people with bladder exstrophy. It's rare, but like they said, there's a 70% chance, but it can be rare. Okay? Babies born with bladder exstrophy and epispasdias admitted to GOSH, Great Ormond Street. Alright, this is for the UK people. In the first few days after birth by ambulance from where he or she was born, because GOSH is a major hospital for bladder exstrophy over in the UK, so which is good. Okay, his or her abdomen wall will be covered with clean film because they want to try and protect everything. They don't want anything to dry out, so you wrap it in that, which protects the bladder surface and allows staff to observe the area closely. Yep, that's correct. Yep. Bladder exstrophy and epispasdias are carried in a series of operations over the first few years of life. Okay? The overall aim of treatment is to prevent any kidney damage because of urinary tract infections or reflux back up into the kidneys. We don't want that. And correct the anomalies so that the child's urinary system and genitalia work properly and look normal as possible. Okay? The child's urologist, a specialist in problems affecting the urinary system, will explain the treatment plan for your child. This is vary from child to child, alright? So one child's way of getting fixed is going to be different to another one, so it's very complex in that form. Before each operation, the child surgeon will visit you to explain about the operation in more detail, right? Discuss any worries that you might have and ask to give you a permission for the operation by signing the consent forms. That's very important, okay? Having your consent to allow your child to go under anesthesia and another operation. An anesthesiologist will also visit to explain about the anesthetic and pain relief after the operation. Yeah. The operation closes. Okay, what do the operations involve? Bladder exstrophy, bladder and abdominal wall repair first few days of birth. Okay. This operation closes the bladder and abdomen wall so that the bladder is inside the body and it is correct position. After the operation, urine will drain from the bladder through a number of catheters, plastic tubes placed in the bladder. The child will come back to the ward to recover. For the first few days or so, they will have an intravenous infusion drip, giving fluids and medications until the bladder starts to recover. The child will need to have regular pain relief. After the operation, internal pain relief will be given through an epidural, okay? They may also have stents in place, which are thin tubes inserted through the abdomen into the child's bladder and up each ureter. These drain away urine while the bladder recovers from surgery. A urethral stent will also have been inserted into the urethra to keep it open while the area heals. After the first week, some of the tubes will be removed. The drip will be removed when the child starts feeding again. Alright? The epidural is usually removed 3 to 5 days after operation. 7 days after the operation, the nurse will remove the ureteric stents that they were inserted. They will drain on the ward. Okay? We will give the child pain relief before, although it may still be uncomfortable. Yep, I understand that. The child will be able to go home once they are recovering and they have are reviewed by the doctors. Around 3 months later, the child will have a cystoscopy to check how the bladder is healing. Interesting. See, I'm learning new stuff as well. Okay, the Cully's procedure. I never had this, but this is one of the ways that they fix bladder exstrophy these days, and it's a very interesting procedure. Okay, after the internal closure of the bladder exstrophy, there is no sphincter at the junction of the bladder and urethra. The Cully's procedure, also called a soft tissue reconstruction of the bladder neck, using existing muscles and soft tissues to create a ring of muscles that act like a sphincter. This holds urine in the bladder, allowing it to stretch and gain more capacity, and also helps form a strong stream of urine when weeing. Okay? The surgeons can create a tummy button during this operation if preferred. Okay, nice. I never had that. Would have been nice to be offered that, but I never did. Okay, in boys, the Cully procedure may also involve reconstruction of the urethra and penis, and also may be done in separate operations at later stages. Okay, during the same op, the ureters may be repositioned within the bladder if they are not joining the bladder in the correct place. This can cause a condition called vasculourethral reflex (VUR), where the valves can fail, allowing urine to flow backwards from the bladder towards the kidney. That's not good. Depending on the severity of the VUR, sometimes the urine can flow backwards as far as the kidneys. This can damage, yep, that's right, damage the kidney and eventually lead to kidney failure, which I have heard a lot of people have kidney failure, but that's nothing to worry about yet, okay? The uric reimplantation operation involves disconnecting the ureters and reattaching them in the correct place. Okay. Are there risks of the operation? Yes. All surgeries carry out small risks of bleeding during or after an operation. Okay. Every anesthetic carries a risk of complications, but it's small. There is a small risk of infection, but the child may be given antibiotics as a precaution. Alright? After the first operation to repair the bladder and abdominal wall, there is a risk that the wound will not heal properly and open up again. This can cause the bladder to move out of position. This happens more often if the area to be repaired is irregular, as the skin needs to stretch to cover it. If the wound opens up again, your child will need another operation to repair the bladder and abdominal wall. The surgeons may correct the pelvis bones during the operation as well. This also is a risk of kidney damage. In children with bladder exstrophy, the abdominal joint between the ureters and the bladder allow urine to flow backwards towards the kidneys. This is called VUR, and it can sometimes lead to conditions called that, where the kidneys become swollen, and both conditions will be maintained closely throughout your child's treatment. What is the outlook on bladder? Outlook for babies born with bladder exstrophy. The outlook for babies born with bladder exstrophy is good, and although around 20% of children born with bladder exstrophy need some further treatment later on in childhood, they are having problems keeping dry. Following the Kelly's procedure, if a ring of muscle around the base of the bladder is too weak, urine can dribble out all times. This happens to bladder cannot hold urine. This can impact on the operation called bladder augmentation, which involves this can improve with an operation called bladder augmentation, which involves making the bladder larger and therefore able to hold larger volumes of urine using a section of intestine. These children can empty their bladder using a catheter to drain away urine. A catheter can be inserted through either the urethra, that's me, or separately made channel called a mentropholoth. That's more common these days now. The external genitalia involved born with bladder exstrophy epispasdias will always look different from others. In males, the penis tends to be shorter and broader, but does not usually cause any problems with their sex lives. Men born with bladder exstrophy have fathered children, although may need fertility treatment. In many cases, sperm production is normal and the sperm are healthy, but ejaculating may be a problem, which I have that problem. Women born with bladder exstrophy have also had children, although pregnancy should be supervised by a specialist obstetrician, and the babies are usually delivered by C-section, cesarean. Long-term follow-up. The child will need regular checkups to make sure that everything is working properly at various life stages, such as starting primary school, transferring to secondary school, and finishing school. Support from psychologists will be offered. These will happen until the age of 16 or so. When young people transfer to the adult urology services, we generally transfer them to, that's in London, where they will continue to be under the care of a urological surgeon. They will still need to have regular follow-up appointments, but often less frequently than before. We'll work with you and your child to make the transfer from children's to adult services smoothly as possible. Now, that's a bit of a general idea of the condition. For me, it has been a bit difficult to try and get through all of this. It's been a big battle, but I'm an adult and I'm gotten through most of it now. But I do still have problems with leaking urine and wetting the bed, which is not fun. It's a struggle, but I know I can get through it. But yeah, we need this to be reached out to the rest of the world to explain everything. I hope that my video tonight has helped someone understand the condition a bit more. It's a very difficult thing to live with, but there is support out there. And if you are struggling like I have been struggling, there's always help. Always ask for help. It's okay to ask for help. So when you see this and you need help, just ask for help. Okay, everyone, that is it for tonight. You guys have a fantastic evening wherever you are in the world, and blessings from me to you. Okay, guys, bye-bye until the next video. Bye, everyone.